Hello everybody, welcome back to my channel. In this video we will talk about the vaccines available to protect from Mr. Virus that everyone is sick to talk about, and we will explore whether or not these are covered by health insurance. We will answer such questions as: do I have to pay for a vaccine? When can I get it? Is my health insurance company going to cover the cost of the vaccine? And so on. This video will help you understand if the insurance company will cover this, whether you have employer-sponsored corporate health plan, individual and family health plan, Medicare, or if you don't have health insurance at all. I'm not going to talk about whether or not the vaccines are safe, whether you should or should not get it, and so on. I will only concentrate on the cost, coverage, and how health insurance may or may not help you cover the cost. You are free to leave comments or concerns under this video. The COVID-19 vaccine has received FDA emergency use authorization. This means that the vaccine meets strict criteria on quality, safety, and efficiency. Therefore, the insurance companies are required to pay for the vaccine, as this is considered preventative. Now, let's get straight to the point. There will be no charge for the vaccine itself. Lately, most insurance companies agreed to cover their sharing responsibility for the doctor's visit associated with the immunization as well. That means if you have a private major health plan, even a grandfathered one, medi-cal or Medicaid or Medicare, you will not need to pay extra to get vaccinated. So again, it doesn't matter what level of coverage you have, bronze, silver, gold, or platinum. It doesn't matter what your deductible, copay, or coinsurance is. There is no cost associated with administering the vaccine. The COVID-19 vaccine will be billed as a preventative procedure, and as you know, you do not pay anything for preventative checkups with any type of major health insurance at the moment. If you don't have health insurance, there is also no charge associated with administering the vaccine. If you address other health concerns with the doctor during the appointment, then you may have to pay for that extra, but not for the vaccine. This information is true for the United States of America during the pandemic. What will happen once the pandemic is over is unclear, but most likely the vaccine will no longer be free. Again, the zero cost is for the duration of the public health emergency, currently effective through April 21st, 2021. It is very important to keep one thing in mind. This information only relates to major medical plans. Plans that are not regulated by the ACA have restrictions. The vaccine coverage requirement does not apply to plans that are not regulated by ACA. So if you have a short-term health plan, which is illegal in California, by the way, a fixed indemnity plan, healthcare sharing ministry plan, a Farm Bureau plan, or a travel medical plan, you may not be able to get the preventative procedures covered by the insurance company. However, keep in mind that if you are uninsured or covered under a health plan that doesn't have to provide coverage for the COVID-19 vaccines, you may still be able to get the vaccine at no cost under programs that have been established to provide testing, treatment, and vaccines for uninsured Americans. The vaccine is currently being administered in a phased approach. Since supplies are limited at this time, vaccination will be in phases, but close with those at highest risk getting the vaccines first. The FDA authorized COVID-19 vaccine distribution, and this is being coordinated by the CDC and state health departments. If you do not belong in any of these groups, you may have to wait, and given the dynamics, you may not have to wait too long. You can always check with your state health department on which groups are currently prioritized. You can also speak with your primary care provider or healthcare professional about the vaccine recommendations given your specific health conditions. As vaccines become more widely available, it should not be an issue to get the FDA authorized COVID-19 vaccine easily and conveniently. Now, one final thought. You have to be very careful not to fall into any schemes related to the vaccine. Be on alert for fraud. If someone calls, texts, or emails you promising access to the vaccine for a fee, don't share your personal or financial information. No one should ask you to pay to put your name on a list to get the vaccine, and no one should ask you to pay to get early access to a vaccine. Thank you everyone for watching this video. If you believe this information could be helpful to someone you know, please feel free to share and spread the word. Also, if you like and subscribe, I will really appreciate that, and this will help me tremendously to get found among tons of videos on YouTube. Stay healthy, everyone.